I'd like to share another great before and after of an Invisalign first treatment. This is a phase one treatment. We don't use the palatal expander nearly as much as we used to. That's the device that a parent has to turn with a key that's fixed in the mouth that affects speech. Food gets stuck to it. These are removable aligners. Look at the difference in the shape of the mouth. You can see how the front teeth are lined up beautifully now. And this is great position, but the alignment can only occur if we have more room. And that's what the aligners did in terms of expanding the mouth. And you can see now, since the treatment started, and this was 1 year, right here it says treatment plan 4, and that was in December of last year. So it's been a little over a year, and now we have already the first premolar growing in here. It's about to come in over here. This canine is out much greater width. We have a table that shows width. And you can see that 4 millimeters at the canines, 5 millimeters at the primary molars. So great expansion and alignment and a nicer looking smile. And in the lower, look what's happened. We've already lost this baby tooth and this baby tooth, and the new ones are already in the right position. They could not fit unless we had more room. One of the nice things I find about aligners in this age group of 9, 10-year-olds is that you get some help with the loss of the baby teeth. And you don't have to pay for an extraction or get a shot. It just kind of happens, quote unquote, naturally. So now we're in a much better position. This patient will still need comprehensive treatment because there still is some overjet and the occlusion is still not perfect. But we time that to work with the bodies, when especially boys or girls are at the growth spurt. So right now for this patient, it's still a little too early. I'm going to wait for more teeth to grow in. Hopefully this tooth, which is loose, will come out soon. And we'll have a period of observation of about a year and a half. Then we'll wait for hopefully a full eruption of everything and then probably go back into aligners again. This is an efficient, modern, clean, comfortable way of orthodontic treatment. And I'm thinking more and more orthodontists will adapt what I was an early adapter with, not just with Invisalign way back in the early 2000s, but with Invisalign first, which we've been doing now for a few years with great results and no palate expander, no braces. Guess what? You can tell your child they're not going to have colors and braces, that this is much better. And they like the clear aligners now more and more. They see it with adults. Little girls love to look like their mommy and carry that little case around. This is the trend. So come take a look at what we have to offer at Goodman Orthodontics, and we'll share our views with you. And if you're not in New York, ask your local orthodontist about Invisalign first.